when it comes to this is not a response video, but I don't know what this is, but there's a doctor named Dr Syl, SYL on YouTube. I think he's like a psychiatrist, or so I just making sure that my door was closed. He's like a psychiatrist or a psychologist. I don't know. He's a doctor, I guess. I don't know. He made a video about the complexity of psychiatric diagnoses or whatever, and I was shocked that someone made that video. I forgot what he said in the video. I think he was talking about the pros and cons of diagnosis. Maybe, I don't know. I could be confusing that with another video, because there's another video by another guy. I think his name is, I'm sorry if I'm butchering these people's names or if I'm getting it wrong, or maybe I'll show some screen caps or something. There's another guy named, I think his name is Daniel Mackler on YouTube. He made a video called Why I Quit Being a Therapist, 6 Reasons. He talked about, like, you know, the cons of being a therapist and whatnot. The pros of getting a psychiatric diagnosis / diagnoses, whatever, is that you get a name for what is wrong with you, or however you politically correctly, whatever, you know, you get a name for your experience, right? That should be the obvious, yeah. But the cons, are like, it puts you in a box, you know what I mean? And if you don't fit certain criteria, you feel invalid. Like, there's a lot of not otherwise specified conditions, you know, like this. We always hear about Asperger's, but I never hear about pervasive developmental disorder or not otherwise specified. I never hear about that. 99% of the high-functioning autistic people are Asperger's, and I don't relate to that. I can't find anyone out there that's against the Asperger's label, and then when I do, the reason why they're against the Asperger's label is because allegedly, I don't know if this is true or not, Hans Asperger was I can't say it, but he was I can't say the word, N-A, you know, I can't say it, can't say it, starts with an N, ends with an I. So that's the reason why a lot of people are going against that label. I go against the label because I just don't fit the symptoms of it, you know. That not otherwise specified, pervasive, whatever, that fits me better, but I don't know. And I don't know, I mean, like, obviously something wrong with me, it's just I don't fit in any of these labels. There's like 200 or 300 mental disorders in the psychiatric book, and it's like, no wonder why people have a hard time getting a label diagnosis, because you have to go through so many to figure out what the hell you even have, and then you go to 10, like for me, I go to 10, a little off topic, I go to 10 different psychiatric doctors and I get 10 different answers. Autism, no wait, ADHD, no wait, both, no wait, bipolar, and it's like, what it even is, I don't even know. Sometimes I don't even get an answer, like this therapist that I'm seeing in this current state of time of being won't even give me a label for anything, so I don't even know. He doesn't even want to, this new therapist doesn't even want to label me. I get a lot of those doctors too. When I say doctor, I don't mean physical doctor, you know what I mean. It's just really fucking frustrating. Told all my life that you have problems. Well, what are those problems you speak of? can't live on my own, never finish school, have to still live with my parents, have to record silently in my room, have to record in my mom's car, have to do everything. I was thinking maybe I'm mostly neurotypically normal, but that doesn't make any sense because when I think of mostly neurotypically normal people, when I think about that, I think of like someone that has a wife and a kid. They have a wife or a husband, or they have kids, and they have a job, but they have a little bit of depression or anxiety issues or whatever. For me, I'm mostly mentally ill, but it's like not otherwise specified. I don't think I have ADHD. My disorganization is too disorganized. It seems as though it's like a manic, schizophrenic. I don't even know what it is. I don't hear voices. I don't know. That's the problem. Again, labels are good. I think the pros to psychiatric diagnoses is you get a name for what's wrong with you, your experience. I feel like the majority of people fit in that box, but I seem to be the glitch in the matrix where I just don't fit in a box, label, system, category. But that doesn't make me normal either. So that's the cons. That's the cons of getting a label, is that sometimes it doesn't fit. Sometimes there is no label for you. You know? That's my story. There is no label. You could call it schizotypal personality disorder, disorganized schizophrenia. You could call it anything, but, you know, my magical thinking isn't too weird. I can make eye contact. I don't know what it is. I don't know. But that's just my little rant about how, like, the cons of psychiatric diagnoses is some people just don't fit in a box, like me. People like me are rare, though. Usually I find people that fit in multiple boxes. Like, I meet people that say, I have bipolar 2, I have OCD, I have ADHD, I have whatever. You get a lot of those people. Those are what I call dual diagnosis or multi-diagnosis people. For me, I just don't fit in anywhere. You know what I mean? You know? I do have some labels, but I don't really agree with them. I don't know. But that's just my opinion. Is that there's so many mental disorders, you can't tell what you have sometimes. A lot of them look similar. And I just don't fit anywhere. I mean, if you want a label, that's fine. If you want to go on medication, that's fine. But I'm telling you, people, I relate to the cons of psychiatric diagnoses. I do want a label. Like, I'm not saying don't label me. Like, but at the same time, I don't know what I want. Like, I do want a label, but I don't think it exists for me. I'm not like one of those people where it's like, don't diagnose me at all, don't label me at all. No, like, I kind of do want a label, but I think I gave up trying to. I don't know what it is. I don't know what it is, people. Because there is people where they go to therapy and they're just like, doctor, don't diagnose me. That's not me. I do kind of want a label. I just don't know what it is. That's basically what I'm trying to get at. I don't know. This is good. This is the end. Please be nice in the comments.